Okay, assalamu alaikum, and welcome to this afternoon panel that we've assembled to discuss COVID-19 and community. Um, we have today with us Dr. Riyaz Sirajuddin, who is a community member and cardiologist here in Oklahoma City. In addition to him, we have Dr. Kamran Riaz, who is an ophthalmologist here in Oklahoma City and a Hafiz of the Quran. And I am Hakeem Shakir. I am a neurosurgeon here in Oklahoma City. The reason why we have assembled this panel today is to discuss COVID-19 and how it applies to us as regular citizens here in the United States. And in addition to that, how it impacts us as Muslims and the Muslim community at large. So it's kind of a twofold discussion here, one with the basics of coronavirus and how it impacts us as Muslims. So I will ask Dr. Riaz to begin with a dua if he would like to get us started.
بسم الله الرحمن الرحيم والصلاة والسلام على رسوله الكريم وعلى إخوانه من المرسلين ومن تبعهم بإحسان إلى يوم الدين. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما وعملا ورفيقا مما يقربنا إليك. اللهم إنا نسألك علما نافعا وقلبا خاشعا ولسانا ذاكرا وشفاء من كل داء يا أرحم الراحمين. اللهم إنا نسألك العفو والعافية والمعافاة الدائمة في ديننا ودنيانا وأهلنا ومالنا وصلى الله على سيدنا محمد وعلى آل سيدنا محمد وبارك وسلم.
So we would like to begin with the general basic coronavirus questions. And I'm going to start by asking Dr. Sirajuddin, a series of questions. Some of have come from community members and even our friends of the community. The first question I have for you is, what is COVID-19 for those of us that are not in the medical or science field? What is this?
It's a good question. COVID-19 is basically the name given to the illness caused by the coronavirus. And right now we are in a COVID-19 pandemic, basically saying it's worldwide, as opposed to localized to any one particular region per se. So in a nutshell, that's what COVID-19 is. But what is it actually as an illness? There's been several stories and there has been several descriptions of it. First, to start off saying it's just going to be like a flu-like illness, and some people are going to get affected more than the others. It affects the old, it affects the young. So all kinds of no, I won't say conflicting, but all kinds of different data on the social media and things like that. But in a nutshell, it is a disease which is caused by a virus. So basically we don't have any kind of a magical cure like we do have for bacterial illnesses where you take an antibiotic and you're over it. Although we do have some retrovirals, but this is a viral illness. And the reason it's taken a toll on the community is because the impact it has in people who end up having pneumonia as it affects the lungs. People rapidly deteriorate and end up in life support on ventilators and don't make it. But the reason it becomes a pandemic is because although it doesn't affect every single individual at this level, 20% of the people who get affected are really, really sick and they end up needing the hospital. Now, the other 80%, although they don't get sick, but they end up becoming vectors. In medical terminology, is basically carriers, but in late term, basically you are carrying the disease and you can actually hand it over to anybody else, although you're not sick. So in a nutshell, that's what we are experiencing, is because you have so many people who are carrying the disease and it's easily transmitted by virtue of the air, by virtue of touching droplets. So basically when I'm talking right now, there is some element of air coming out of my body outside, or some element of droplets when you cough or when you sneeze, which are there in the atmosphere. So it's very easily transmitted. And that's kind of where we are right now. I could go on talking for a long time, but I want to cut it short. So COVID-19 is a bad illness. It is really bad, easily spread, and it's worldwide. And the only way we can prevent is by social distancing.
So I have patients that tell me, Doc, how is this any different from the flu? And why should we be more scared of this than any other, flu or, SARS or whatever we've seen in the past? How do you, um, what's your response to those kinds of folks that are, don't kind of understand the difference between the flu and coronavirus?
The flu as such is basically was bad by in itself. So when you have a flu, which is also by like influenza, the different virus strain. So when you do have the flu, you could get really, how can I put it, fatigued, tired. You could end up having trouble breathing and it becomes a prolonged illness. And people who are older, sometimes they don't make it. So it's deadlier in people who are immunocompromised and older people, where they just get sick and they end up, and there is no cure for the virus, right? So just as opposed to a bacterial pneumonia, you keep hanging all kinds of drugs like antibacterial drugs like antibiotics. With the virus, you don't have that luxury. So with the flu, which is influenza, which is really bad enough, a lot of people end up dying from it. But usually if you're younger, you're able to overcome it. When you're older or you're immunocompromised, meaning you're not able to fight the infection, you end up getting sick and people do die with the flu by itself. What is coronavirus, COVID-19 illnesses? It's taking a flu and how can I put it, multiplying it 10 times in its severity. So somebody who gets sick with the coronavirus, they rapidly deteriorate, meaning if they're having the same pneumonia as a flu virus, as a normal influenza flu, you're getting sicker 10 times worse and 10 times faster. The other thing is the older people are probably going to be affected similarly between the influenza, the regular flu versus the coronavirus, and rapidly deteriorate, things like that. But the only problem with this one is it's affecting the younger population as well. There are multiple stories you can hear from talking to other healthcare professionals, as well as looking at the stories all over the world. 40-year-old, 30-year-old physicians, non-medical people who get it, and they end up having like one day they're fine, the next day they're on the ventilator, intubated. So the reason is, why is that, or how can that happen, and why is that? It doesn't make any sense. Basically, if you really look at it, there's a possibility there's two different mechanisms. One is you're old, you're not able to fight the infection. The other one is you're young, you're trying to fight the virus off, and then you end up having a hyper fight mode or hyper response mode, where your body is secreting all these cytokines to fight, and you end up involved in this so-called chaos in the body, and then you rapidly deteriorate. It's a different kind. So that's why when you really talk about people who are in the 30s and 40s who rapidly decline, you will hear a lot more stories of people on the ventilator overnight, as opposed to, you don't hear the people who are 70 or 80 rapidly deteriorate. They have a more slower rate of decline, but they really don't make it. Whereas the younger people, they are fighting, but the problem is the fight is they're losing their fight. And people are on ECMO ventilators, with permanent lung damage. So that's kind of in a nutshell how is it different between the regular flu and the COVID-19.
Look, this question. So you're an ophthalmologist. I'm wearing glasses. You're wearing glasses. I usually am a contact lens wearer. What's the word on coronavirus being transmitted via eyes, or what's the data there? What do you suggest to patients who are contact lens wearers like myself? Not right now at this moment in time, but what do you suggest to people?
Yeah, to date, there's no evidence that we have at least documented that the eye is the primary source of infection, or somebody who got the coronavirus through eye contact or secretions through the eye. But what currently the American Academy of Ophthalmology has recommended as of a few days ago, this is just I want to say earlier in the week, maybe, so it's less than a week old, is that they've really advised strongly for people to avoid wearing contact lenses for several reasons. One is a lot of times when we put contact lenses on, we don't properly sterilize and clean the hands. So if there are any respiratory droplets or fomites that we've picked up from other places, that may go into the eye. And because a contact lens is essentially like a sponge. It may have some of these virus particles that then can proliferate in the eye, in the secretions, and then gain access to the body that way. And then the other thought is that, as Dr. Sirajuddin was talking about, that a lot of times when we speak or cough, there's particles which come out from our mouths. And if that kind of gets lodged into the contact lens of another person, it has essentially like a petri dish on the eye where it can kind of grow and proliferate. So these are two thoughts that have been out there, and that's why the American Academy of Ophthalmology, which is the largest body of ophthalmologists in the United States, has made that recommendation. There are two papers that were recently published earlier this week in JAMA Ophthalmology that came out of some of our colleagues in China that talked about some of the manifestations of COVID-19 in the eye, and it's very similar to other viral illnesses, so it can cause kind of like a conjunctivitis, sort of like a pink eye type of a thing. And we know how infectious pink eye is. Like when a child gets it, for example, they're told to stay home, or anybody who gets it told to stay home because of the, we touch our eyes constantly. Even in this recording, I've touched my eyes once, you've touched your eyes once. Dr. Sirajuddin has not touched his face yet, but I imagine he will. But that's how we get pink eye. We often touch our eyes, somebody who has it, then touches somebody else. So we know that it can cause that. But to my knowledge, thankfully, there's no long-term vision consequences of this particular virus. No one's gone blind from this virus, so alhamdulillah, at least that's there. But as Dr. Sirajuddin was talking about, the other health issues are certainly there. So we as ophthalmologists, I think, are more support staff for our IM and ER colleagues, and we can certainly do our part to educate the public. But we are following their lead, and I've spent now past several weeks talking to many people, colleagues of mine who are IM and infectious disease docs, and really just following their recommendations rather than me trying to take the lead on anything.
Dr. Sirajuddin, when should patients who suspect they may have COVID-19 actually go to the hospital or seek medical attention? When should a patient go to the ER?
Well, there are two ways to answer that question. The easy way out is in the state of Oklahoma, you have the Oklahoma State Department health hotline. Okay, the other one is 211 is a number. But if you really ask me per se, that it boils down to the symptoms of coronavirus and how do you know you actually have it or you don't have it. So one of the things which people don't realize with the coronavirus, the fever is a very big sign, to tell you that if you are infected, if you have the COVID-19 illness, the fever and cough are huge. Now, with regard to when to go to the ER, I feel anybody who has any trouble breathing and who's having chest pain along with the fever and cough, I think it's time to go to the ER to get evaluated. The reason being is because you don't want to go to the ER and get exposed to people who could be at risk for unnecessary reasons, and then you end up contracting the coronavirus without you needing to. So the reason you would go is, number one, to get respiratory support, because there's no magical therapy. It's not like you're going to the ER, they're going to give you a shot and you're going to be better. Basically, it's going to be supportive therapy. So unless you are bad enough that you think you have the COVID-19 illness and you think you're going to require, and you're going to rapidly deteriorate, I think it's better to stay away from the ER. But as I said, the biggest disclaimer I can tell you is not to take any chance, because the Oklahoma State Department is obviously up to date with all the CDC recommendations and what's happening on a day-to-day basis. And they actually have the 211 hotline for every one of us to call if we have any kind of question about it. So if you do feel that you have fever or cough, watch yourself, quarantine yourself, and see how much. And fever, anything above 100.4 is concerning enough. And usually your typical fevers are up to 102. And cough and breathing issues. These are three things I would feel very, very uncomfortable sitting at home if I'm having chest pain and trouble breathing, along with the other two symptoms of fever and cough.
There has a lot of information disseminated on internet, Facebook, etc. One that I've seen recently was if you drink water or fluids or even warm fluids, Q 15 minutes, every 15 minutes, that will reduce your risk of getting the coronavirus. And one of our community members actually on the Facebook page asked that question about, is it true that if I drink fluids and actually hot fluids, can that help me minimize my risk of getting coronavirus? What do you say to that?
That's a good question. These questions are typical questions for which, in my opinion, I don't think anybody in this world has the right answer to it. Nevertheless, the rationale behind all of these maneuvers is basically that by you doing that, your body is going to be healthier. The reason the warm water comes into play is because when you are drinking warmer water, there's a higher chance that the virus is not going to survive in warmer situations or environments. So that's the rationale behind drinking the warmer water. By drinking fluids every 15 minutes, you're keeping yourself well hydrated and well nourished, basically. So like you would know for the flu, what they say, for the common cold, they used to always say, feed the cold. Basically, you want to eat and get yourself strong enough to fight any kind of a viral infection. So that goes along with that. But more importantly, I feel you need to, how can I put it, boost your immune system by taking vitamin C supplements, zinc kind of deals, which have proven in many studies to possibly get you either recover from any kind of a viral illness a little bit faster. But again, there is no large scale data or anything for me to say this is evidence-based advice. So I don't think anybody has that answer. But I think anything and everything can help as long as there's no side effects associated to it.